Hi, I'm Kristina Jackson, and I'm a professor at the Rutgers Robert Wood Johnson Medical School and the Associate Director of Epidemiology, Etiology, and Prevention at the Rutgers Addiction Research Center. In this study, we looked at what happens on days when young adults use both alcohol and cannabis compared to days when they drink alcohol alone. So there's been a lot of concern that cannabis use might increase alcohol-related harm. So we wanted to understand what was really driving that risk. This particular study was conducted as a follow-up to an earlier study I did with my colleague Rachel Gunn, in which people told us that when they experienced problems after consuming alcohol and cannabis, it was because of their drinking. That is, they attributed the consequences to alcohol. So this made us wonder, does the amount of alcohol consumed account for the consequences? And so we did a 28-day field study, and what we found was actually pretty clear. On days when people used both substances, they tended to drink more alcohol. And it was the higher number of drinks, not the cannabis use itself, that explained why those days were linked to more negative outcomes, like hangovers and regrets, and fewer positive effects, like feeling relaxed. So in other words, the added risk seems to come from drinking more rather than from direct cannabis use. And so this is important because it tells us where we want to focus our prevention and intervention efforts. And these findings really reinforce the value of harm reduction that can help young adults reduce their total alcohol consumption, especially on days when they might be using cannabis. So understanding how these substances work and interact in the real world can help us design better, more targeted approaches to reduce alcohol-related harm.